In this video, we are going to look at a right stain peripheral smear to determine if it is a good smear, meaning when it was made on the slide, and also if the staining characteristics are there to support that it was a well-stained slide. And we're going to do a few things. First of all, the microscope is set on the 10x objective lens, and we're going to start out here. And one of the things that we need to do before we start a peripheral smear exam is just look around and see if we have an even distribution of the various cells. So, the types of cells that I'm looking for are the white blood cells, the red blood cells, and the platelets. So starting here on 10x, the first thing that I'm going to do is just kind of look around a little bit and see if there's an even distribution. So right now I'm just looking at the white cells, and what we can do, like this is like right in the middle of the slide towards the feathered edge, and if we go out to the feathered edge, we can see, like here we can see, the number of the distribution of white blood cells. But if we go out to the very end, we can see that there's a greater amount there. And that's kind of normal, because what happens when you make a slide is that the larger cells get pushed to the end and also to along the sides. So one of the things that you want to look for here is, like I said, just kind of the general distribution of white cells, and I would say what we're seeing here is rather normal. If you saw a greater concentration in comparison to what we just looked at, kind of more towards the middle of the slide, you might be concerned. You might want to go back and make a new slide. Another thing that might turn up here are blasts. Because those, if you recall, in the bone marrow, you have stem cells, and then after a stem cell, the next stage that we see are blasts, whether those be myeloblasts or lymphoblasts or erythroblasts or pronormoblasts. And they tend to be the largest in the sequence of cell maturation in the bone marrow. So if we have a patient who is releasing blasts into the peripheral blood, of course that is abnormal, and that is something that we absolutely would want to catch. We'd want to see those blast cells. So first thing we're going to do is we're going to go to the place where they may very well turn up. So since they're usually the biggest, it makes just kind of sense that they would end up here. So I'm going to take a look here, and I'm not seeing anything. Now, what I'm going to do is I'm going to go to the edge of the slide. Okay, almost there. Okay, there we are. We're at the edge of the slide, and some people like to refer to this as blast alley. And I always just take a quick look here, because once again, larger cells, meaning white cells, and specifically larger precursors like blasts may get pushed out to this area. So it's always good to just do a quick run just to see if you can pick anything up. Okay, so I'm not seeing anything. So now what I'm going to do is I have to kind of determine where I would start my differential. And we are going to go up to 40x for that. And this is 40x dry, so we refer to this as the high dry lens. And what we're looking for is, at this point, is where the red cells are going to just start to touch each other. Or maybe not quite touching each other. So, if we look here, we can see that the red cells are just kind of starting to overlap a little bit. There's a good spacing between them. Now, to show you what the contrast to that is, if we go out to the edge, you can see here how the red cells are not, they take on kind of the shape of each other, and there are these big gaps in between them. And one of the things that you'll notice is that these red cells don't have any central pallor. So this is really not a good place to be one to start a differential. Now on the other end, if we go into the thick end of the slide, here we can see the red cells, they're just on top of each other, and that's not good either. And one thing you may notice is that the white cells tend to be abnormally, the morphology is not ideal when you start to go back here. Because they start to get a bit condensed. So for that reason too, we really wouldn't want to do an assessment of the cells way back here. So let's go back out to where we think would be a good starting spot. Okay. Okay, so for me, this looks pretty good. We've got a neutrophil, segmented mature neutrophil there rather in the center. The red cells are just sometimes just kind of touching each other. Another thing that we're going to want to do is we're going to want to assess the quality of the stain. So what that means is that the red cells, should have kind of this pinkish tan color. They should have a central pallor if they're normal, and the hematology analyzer printout on this particular patient, everything was normal. So I expect, when I put the slide on the microscope, that we're going to be seeing normal red blood cell morphology, and that looks to be the case. And it does look like these cells have stained properly. Now, when it comes to assessing white cells tend to have, like for example, this neutrophil. The nuclei or the nucleus in an individual white blood cell is going to be kind of deepish purple or deep blue, and depending on what type of white blood cell it is, it's going to be fairly compact. And the cytoplasm of a neutrophil is going to be kind of this kind of pinkish, purplish color. And for me, this particular neutrophil looks pretty good. Let's go around and see if we can find some other cells. Okay, so here we have a small lymphocyte. As you recall, there are two types of normal lymphocytes. We have the small, like this one, that might be around the size of a neutrophil. It tends to be kind of roundish, and the nucleus also tends to be round, and the nucleus tends to take up most of the inside of the cell itself, and the cytoplasm tends to be kind of darkish blue or kind of purplish, and I would say that looks like the staining is correct on that one. Okay, I'm just kind of hoping to find. Okay, now here is a large lymphocyte in contrast to the small one that we just looked at. And first of all, it's bigger than that other lymphocyte. What differentiates it also is the fact that the nucleus tends to be rectangular. And the cytoplasm, there's going to be a bit more cytoplasm. The cytoplasm is going to be kind of a lighter blue color than the dark blue of the smaller one, and maybe the chromatin is not going to be quite as clumped as in the small lymphocyte. And let me see if I can find a good example of a monocyte. Okay, so here's a monocyte, and as far as like looking at it to judge if the staining of the slide is good, I would say it is, because monocytes tend to have a cytoplasm that's kind of this grayish color, and I see that in this monocyte. And the nucleus is also kind of this dark purplish color, but not as dark as, for example, a small lymphocyte. So this looks pretty good. Now, another thing that I would look for when it comes to judging cellular distribution is the platelets. So when you're looking around, if you have good eyes on 10x, you can see if there's platelet clumping, meaning that groups of platelets that are abnormally adhering to each other. And but I like to assess platelets on 40x. Rather than 10x. And we can see here, like in the center, we can see some platelets, and it looks like an even distribution. In the very center here, I can see a clumping of maybe about 6 platelets, but in looking at this entire slide, I haven't really seen that anywhere else, so I'm not really going to get too excited and call platelet clumps. And platelet clumps are something that you maybe you could think that you would see if you look at the analyzer printout and see that the patient has like an abnormally low platelet count. But like I said, on this particular patient, the platelet count was normal, or everything was normal. Therefore, I feel pretty confident about the distribution of the red cells, the white cells, and the platelets. I also feel good about the staining of this particular slide, and I think this is a very good slide that you could use to do a differential on.